Are seizures ever part of stroke presentations? Have you ever wondered if seizures can happen during a stroke? The answer is yes, and it's important to understand how they relate to strokes. Seizures can occur during or after a stroke, but this depends on the type of stroke and when it happens. A stroke occurs when blood flow to the brain is interrupted or when there is bleeding in the brain. This can lead to brain cell injury or death. Seizures are sudden electrical disturbances in the brain. They can cause changes in behavior, movements, feelings, or consciousness. During a stroke, some people may experience acute symptomatic seizures. These seizures are directly related to the brain injury caused by the stroke. Certain types of strokes are more likely to lead to seizures. For example, hemorrhagic strokes, which involve bleeding in the brain, or strokes that affect the cerebral cortex, are more commonly associated with seizures. Ischemic strokes, caused by a blockage in a blood vessel, can also result in seizures, especially if the affected area is large or involves the cortex. Timing is crucial when discussing seizures related to strokes. Early post-stroke seizures typically happen within the first week after the stroke event. Later post-stroke seizures can occur after this initial period and may indicate the development of epilepsy due to stroke-related brain damage. From a clinical perspective, the presence of seizures in stroke patients can complicate diagnosis and management. Seizures can mimic stroke symptoms, making it challenging for healthcare providers to assess the situation. Recognizing seizures as part of stroke presentations is vital for timely treatment. This may include using anticonvulsant medications along with standard stroke care. The long-term risk of seizures is higher in stroke survivors, particularly those with cortical involvement or hemorrhagic strokes. Healthcare providers should closely monitor stroke patients for seizure activity, especially in the acute phase. Imaging studies and electroencephalograms can help identify seizure activity and guide treatment. Managing seizures in stroke patients requires a careful balance between stroke recovery and seizure control. Individualized medical care is essential. Educating patients and caregivers about the possibility of seizures after a stroke is crucial for early recognition and prompt medical attention. In summary, seizures can indeed be part of some stroke presentations, especially in hemorrhagic strokes and cortical ischemic strokes. They can occur soon after a stroke or later as a complication. Understanding this relationship is key for optimizing outcomes in stroke patients. Always consult healthcare professionals for personalized advice and treatment.